feeling my way through the darkness.
As an allopathic doctor, a family practice board certified doctor, I'm doing fellowship at the American Academy of Anti-Aging, and now been using this machine for my patients for the past couple months, and it's been interesting, amazing results, and pleased to say I didn't expect those kind of results as a conventionally trained doctor. But the science is kind of different, and the way I understand it, I want to tell you guys about what it is, because it has helped a lot of my patients here. People come in here and use it every day, and it's kind of fascinating. And we have heard a lot of stories about inflammation, antioxidants. I'm going to try to connect those dots and explain what this little thing is and how it works. So it's in, let's start a little bit. I'll tell you about Bemer and what this company is and how they came about. So most of us think about, a lot of these machines come from Europe, right? I mean, you've heard of these kind of things. This comes from Liechtenstein. I can't pronounce the word, but Liechtenstein, yes. So this machine was developed in Liechtenstein about 20 years ago. And since then, they started doing research, and lots of things happened. A lot of public studies were done, research studies were done, and they figured out, how it can help us. And a lot of people have been helped. Millions of users are worldwide right now. But, before we get there, the story starts out by saying, have we ever feel tired, stressed, anxious, low energy? And most of us will say yes. We have felt those symptoms. And we try to figure out where do those symptoms come from. And some theories say that there's inflammation. Some people say there's less glutathione. Some people say there's infection. And obviously there are hormonal issues that happen. But all of this comes down to this one basic idea: electrons. Everything is about energy, overall energy that happens or gets produced in our body. And we may have heard of something called ATP. ATP is the energy currency in our body. It gets produced in mitochondria. And every cell in our body uses energy. As they move, they use energy. Things don't move without electromagnetic currents or energy source. So we'll try this one. Yeah.
Third time's a charm.
No, it won't work.
I
I have this computer out there, but
dang it.
for some reason it won't work because this doesn't have the attachment for it. So this one does, this one does, but so we have had all of these ideas about how we have tried to explain where energy comes from and what blocks energy, right? In the most scientific way, we talk about electrons. An electron transfer in mitochondria, if you have heard about it, in our cells. As the electrons get transferred, they produce energy. And that's what ATP is, adenine triphosphate. Phosphate gets added to it. And we think about all the other cells in the body, whether they're white blood cells, red blood cells, things that move in our body, how we stay together. I mean, this is all electron sharing that allows us to, allows one thing to bind with each other. But we only share things when we're lacking something, right? Two molecules, H2 and O, share electrons because they're lacking. They need each other's electrons. That's why two hydrogen and oxygen come together. If they were all independently okay, they wouldn't need each other. So this machine helps us with producing this kind of a charge. But let's go back and explain how this entire energy science started, right? We have been, for hundreds of years, we've taught about energy science. There are a lot of healers, energy healers, Now the science came about, technology came about, and then scientists figured out, hey, what about scientific way of getting energy? Instead of somebody passing the energy to you telepathically or through, prayers or different ways. But this allows us to receive those negative electrons. And that's the same concept that we talk about as antioxidant, right? Oxidative stress is O+, and that destroys our cells. When we talk about antioxidants, strawberries, berries, those kind of things help us gain electrons. Walking on the grass, earthing, this is all about gaining electrons or gaining a charge, which helps us fight off the oxidative stress that we're getting. Now, we get stress from this EMF or this light or from the radio waves. We're constantly getting bombarded at different frequency levels which are variable. Right? This phone, as the batteries goes from 100 to 0, it changes its frequency, and it continuously bombards us. And those are acidifying us, and hence they cause, eventually, a lot of these things cause mutations in our cells if we're not able to heal them. But what if there was a way that we can charge ourselves instantly and allow our cells to, let's say red blood cells, open up so that they can deliver the oxygen better? If the things that are blocked in our bodies, the small micro vessels that are 2, 3, or 4 microns wide, tiny, tiny, tiny bit, and we have so many cells that get clogged, like a kitchen drain. But what if we had a way to just open them up right away, instantly, so that we're able to deliver the oxygen, deliver the nutrients to the areas that are needing it, pretty much our entire body. So that's exactly what this is doing. So there are a lot of, the category that they talk about is pulse electromagnetic frequency, PEMF. There are many, many different ways of PEMF, right? So there is sinusoidal wave, there is a square wave, there are round waves, there are many different ways of providing the PEMF, which is frequency. This is PEMF, right? This is electromagnetic frequency, but it's not pulsed, it's continuous. So BEMER, the scientists at BEMER, they figured out a different type of pulsation. We all know electricity has a frequency and a magnitude. And as electricity travels, it has a field, a magnetic field around it. Every electricity. Our brain has millions of neurons. They all have electrical current, and EEG is the machine that tests us for that when people have seizures. So we have those currents inside us. What if we can give those microcurrents at smallest fraction that allows our body to get charged? And that's what they did. They have 2 frequencies. Well, there are 10 frequencies, but the current is coming at 10 and 32 hertz. And it starts at 3.5 microtesla, and it goes up by 3.5, up for 10 times. So there are 10 different settings on here that we can get. And it allows our cells to charge. So for example, when the blood is moving, we have seen blood clot, right? Blood clamps together. If the blood is sitting around, it will get clamped together. When red blood cells stick with each other, they're sharing electrons. That is what they're doing. They're sharing electrons. And if they're sticking inside us, and when they're moving through the small vessels, they're not delivering the oxygen that they have. Each red blood cell has 4 oxygen molecules. And they're not delivering the oxygen downstream. Hence, people who have diabetic foot ulcers or nerve damage or strokes. Or tendinitis, right? Tendons have the least amount of blood supply in all the body parts. So things don't heal well because we don't have enough nutrients and enough delivery of the blood. So that's a common issue. Everybody has that. God has given us, or our body, nature has given us a insane ability to heal. And healing happens with nutrients. We can make the cake if we have the nutrients. We gotta bake it, right? We know how to bake it. Our body knows how to bake the cake. We just need the nutrient delivery system to work well. And, dehydration, hormonal imbalance, all this stress that we have, it messes our circulatory flow. And just like how food moves in the stomach, when food goes in, there's a peristaltic movement that happens that goes, it's like, you're holding a rope and I'm holding a rope, and if I pull it up, it will go in a wave-like fashion all the way there. Same thing happens in our stomach, in the GI system. When the food goes in, it moves in a wave-like fashion, starting from the intestines downwards and in the esophagus. Well, that motion in the gut is called peristalsis, but that same motion in the bloodstream is called vaso motion. So vaso motion is the way where this blood vessel that's moving, right? The blood is only moving with the pressure that the heart is pumping at. If the heart pumps, it moves. Heart pumps, it moves. Heart is not pumping constantly. Heart relaxes and pumps, relaxes and pumps, relaxes and pumps. So there is a pause, move, pause, move, pause, move. So that's what's happening to all our nutrients as they're moving forward. It's not just going with a pressure, like, when we have a water hose, water just keeps coming. That's not what's happening in our bloodstream. Our bloodstream is moving, pausing, moving, pausing. So this vaso motion that we have in our body that moves only with pressure gets disturbed as we get older. As we age, as our bodies deteriorate, as our inherent ability to heal slowly goes down because of all the toxins that we're putting in our body, all the things that we're inhaling, all the stress that we have in our life, and some of those things are caused by our own selves. The vaso motion starts deteriorating. It starts going down, and that's one of the reasons why we have blood pressure, right? The pressure inside the blood, our vessels increase, tightening. It tightens. I mean, why is blood vessel tightening? Because it wants the nutrients. It wants something that's inside the blood. It wants to suck it out so that all the nutrients can be used up by the muscles that are provided, or the organs that receive the blood, pretty much our entire body. So this blood moves through, but as it gets blocked, as it goes down to the smallest artery, smallest vessel, smallest capillary to the microvessels, it gets blocked because there's not enough pressure going there. It's only moving downstream because of the pressure from the heart. There's no other thing that's moving there. It's not like I'm holding a magnet and everything is, iron is getting pulled down. Right? We don't have any kind of things that pull the blood to the downstream organ other than the gravity that pulls everything down. So we need something else, and that is the electromagnetic energy. I mean, this bioenergy that's the next frontier of science. We came to nutraceuticals, we have essential oils, and now this is bioenergetics. This is electroenergetics or electroceuticals, however we want to call them. This is the field. Google and GSK and Apple and all these guys, like, within the last 2 years, they've invested more than $1 billion into developing and mass manufacturing bioenergetic machines. I mean, there are many waves and many frequencies that we can provide. So at this point in time, there are a handful of machines that are out there, and the studies show that BEMER is in its own class of pulse electromagnetic frequencies. So BEMER, actually the word BEMER stands for bioenergetic magnetic energy regulation. So, which is a machine pretty much that regulates your energy inside your body, which is electrons, and helps it flow better. So there are plenty of studies on PubMed. If we just type in, PubMed is the journal database by National Institute of Health. And when we Google Bemer Therapy, there are plenty of studies showing, tons and tons of studies on it, right? For different diseases. But we don't want to call which disease, according to our scientific process, it's going to take us another 20 years before we start saying, oh yeah, this is great for diabetes or this is great for stroke. I mean, it's just the time it requires to proof and double proof and triple proof studies after studies once somebody invests into it. So, but there have been plenty of studies that have been already done by different universities, different organizations, and most of them have been not BEMER. So they haven't done almost none of the studies. So, which is kind of cool that we have somebody else doing the study proving the fact that this is a science in itself that's helping us heal. Because we got to look at this, right? If there's something that helps us heal and it increases the healing time, then that's all we need. We just want to buy more time so we can heal better. And then, okay, then we move forward with our life. And so that's what this is doing. And in my practice, I've used it for past 2 months. Currently using it. It's been absolutely fascinating. I mean, some of the things that I have seen that I would not have believed as a family doctor or anti-aging doctor that are possible. You know, people. I mean, I have some more very complicated patients in this area: Lyme disease, cancers, mast cell hypersensitivity, rheumatoid arthritis, and people come in, sit down, and there we go, they start walking. I mean, things have happened. Autism, somebody who couldn't sleep well for last 4 years, haven't had more than 2 hours of sleep every night, barely sleeps, slept 12 hours after 4 sessions of this. So those are the kind of things. It's because it's increasing the healing time. That's all it is. Every body is beautiful, right? Every single person has the ability to heal. It's just what can we do to heal better and faster? Because we can take all the nutraceuticals that are out there. If they're not being delivered, then what's the point, right? 70%, 74% to be exact, plus or minus in different people. Our blood circulation is in microcirculation, which is smallest vessels. I mean, these big vessels that we see are just 25% total. So everything that we have is in the microcirculation. And micro meaning electronic flow, right? We gotta let them move. And so anybody who wants to, you can get one person at a time. If you haven't experienced it, you're welcome to lay down. And we'll get it started, and I'll keep talking, and we'll keep answering questions. Let's see. I mean, the potential of this little machine is insane because it can pretty much heal.
Want me to do that for you when you talk?
Yeah, for sure, absolutely.
I'll zap them.
If you have any pain, you might want to tell everybody.
Okay.
Tell everybody what kind of, if you have any pain, which part of your body hurts, and at what level it is, 1 to 10, 10 being the worst.
Okay, so I have some pain in my toe over here, in my left toe. I kicked something right between my toes a couple of years ago, and it has not been right since. I didn't mean to. So that's one of them.
So what if I do this? Okay, what else?
My lower back, I have a L4 subluxation. I'm working on with a chiropractor, but it bothers me all the time.
So, as she said, she has some injuries and some degenerative changes.
Yes.
And it's been bothering her. And at what level is it right now?
Let's see, the lower back, it's pretty consistently like a 3.
3.
My toe, it depends on how much I walk. If I walk more than 5,000 steps in a day, it's like a 9.
Okay. Great.
What is it?
So
What's your
right
toe
now, about a 4.
So 4 and 3 is her current baseline right now, right? And it gets worse. So she may feel something, she may not. She'll tell us afterwards. And this setting starts at 1 to 10, and then the mat and the pad, both of them have settings from 1 to 10. And one of the cool thing is, you know, we hear about all these things, right? One of the cool thing is we hear about this. This is a tester, right? This is EMF. Right? This phone has EMF. and then this also has EMF. So it will work. So it's the type of frequencies that we're getting is what the issue is, right? The phone and computer and all these things gives us negative frequencies in our body that are erratic. And erratic things take a long time for us to repair. Right? We get those damage and then we have to repair our body. Let's see. So other than that, people report a lot of things like my energy improves, sleep improves, joint pains, you know, pretty much any disease, sugar, stomach issues, headaches, migraines, you name it. I mean, somebody will say, yeah, this helped them get better. There have been studies that are out there. Links are on my website. I've posted them online. You can YouTube Bemer Therapy and Bemer things. And some of those studies that were done, they have reported diabetic foot ulcers getting relieved within 2 months on an 88-year-old lady who is bedridden. And you and I both know that somebody who's bedridden is declining. Right? And ulcers are not going to heal that well. So those kind of things. Hair growth. People who have used it for 6 to 9 months, they start seeing different hair growth. It's also used for anti-aging, meaning the skin tightening, acne. You know, there is this light that we have here as well. So you can use this on your face or on any body area. But people who use it on their face, you can wrap around that pad on the head as well to help circulation on your face. And just as the circulation improves, pretty much your body will automatically improve and heal. I have personally used it pretty much last 2 months. I've had sleepless nights, and I've had nights when I've slept only maybe 2 hours because of things happening, and had to wake up and had to work, and all I did was lay down and put that around my head, and I woke up after 8 minutes. I always fall asleep on this, but I woke up after 8 minutes and I was fresh as a cucumber. I mean, I know that feeling after working 40 hours in the hospital, what it feels like a zombie. And personally speaking, in my own experiment as of now, I've had good results. It does detox. So here's the thing, right? When you open the kitchen drain and when you allow the body to start getting a lot of blood supply, including your liver, that has been stagnant for a while, and all the toxic chemicals that have been sitting in our body parts, they start coming out. I mean, it's not only charging our red blood cells or white blood cells, it's charging everything. I mean, all the silver and metal and pesticides and whatnot you have in your body, it's getting charged. That means it's moving, it's getting mobilized. That means your body is about to get a wake-up call and start seeing things that it hasn't seen before. Which is good, because if you're expecting it, then you can drink tons of water and pee it out or poop it out. And that's what a lot of my patients feel. Some people have loose stools, bowel movement increases. Some people sometimes feel nausea with it sometimes. One person felt nausea. One person felt lower back pain after using it, but that person started at 5, which was kind of bad because you're getting exposed to this frequency straight at level 5. That means it's 3.5, 7, 14, 17.5. So you're getting 17.5 microtesla frequency right off the bat that your body has never seen before. I mean, that's a whole lot of charges that your body has to now put somewhere. So it's going to put them anywhere. I mean, where every single cell will get it. So those kind of things can happen, but then they go away within a day or two once, and then you come back down to level 1 or level 2. Hey, you got it. Genius.
Yay.
What is it?
Here's what I found is if you're into energy or you're really healthy and not on a lot of meds, you're going to notice, you're going to feel things more. Because you're more in tune to your body. There's so many people that have no idea what's going on, you know.
Right.
So I found that the cleaner you are as far as meds, and the more you know, if you meditate, you're more in tune with your body, and you can pick up on it so much faster.
Yeah.
So those are the kind of things that will happen, right? People will feel that when you're new to it. One of the things it does is this machine also has a sleep setting. Meaning, when we fall asleep, for the first 2 hours, it starts out at a frequency and slowly drops down the first 2 hours. So it allows our body to have this pathway to go into the deepest state of sleep, because it's increasing the energy, it's increasing the oxygen delivery, and you will fall asleep really deep. And then as 6 hours pass by, the last 2 hours, you know, at 4 or 6 o'clock in the morning, our body starts releasing these hormones, testosterone, glucagon, cortisol, estrogen. As things starts coming up, this also starts coming up. And it restarts the frequency the last 2 hours. So it wakes you up right out of the sleep. So which is kind of cool, because you can pretty much go to sleep with it, have that low frequency setting overnight. Your body continues to heal better and better. One session, 8-minute session, roughly lasts about 16 hours of time in the body. So, you know, some of the recommendations say that you should use it for twice a day. But I have seen that people who use it once a day, they still have tons and tons of healing going on. And they come in every day or every other day, and they still get better and better and better. Because we're healing them. You're healing yourself, because it's your body and your blood cells. It's just opening up the channels. So, hey, I think it's on. Something is on. So that's what's happening with this machine. If you feel flushed or lightheaded,
Take your time.
Feel good?
Yeah.
You feel good?
Pressure behind my ear when I can't hear it, which is interesting. I had a virus attack my ear 20 years ago, and I still am of the thought that it's going to come back.
When you're feeling something
And I'm just feeling a lot of pressure back here, and I've got a lot going on in this area as well, but I'm also in the middle of a cleanse, so.
that's good.
It just kicked it.
You're gonna
Any therapy you're doing.
I just want steroids.
Make sure you grab tons of water.
Yes.
And drink a lot of water.
Okay.
Because, you know, it just opened up, you know, that 74% of the microvessels. I mean, most of them are open, but we still open up a lot of them.
Yes.
So this machine gets used by a lot of the professional athletes.
How big is this energy field? Because I kept feeling like I wanted to flip you over.
So here's,
you could,
you're right.
cook on both sides.
Depending on, can I answer that? It's when we're on level 1, when we're on intensity 1, it's only coming in about this far. The higher the intensity, the deeper it's going into the body. Okay? So it's the same, it's that's why you don't want to start out with a high level, because then you're detoxing some things that probably haven't been cleaned for a while. But but we can do a very low level. We can just do a 1 if you're afraid of.
Oh, I'm not afraid of it. I was just curious.
Okay.
So what happens at 3.5 microtesla? The field is about
Yes.
6 to 12 inches.
Yes.
And then as you go higher and higher,
It goes deeper and deeper.
It
So.
covers up to 2.5 feet above your body.
Can
But
you feel it? Like when it's on?
get on it.
She didn't scream, did she?
No, she didn't scream.
Some people,
She might be tougher than me though.
Yeah.
some people 100% feel it.
Yeah.
If you're really in tune with your body, some people get really lightheaded
anything
after
burning?
this.
I
I have seen in my practice
let's do this.
patients who come in with high blood pressure over 150, 160. I've had 170 over 100. 8 minutes of this, they're down to 130.
Wow.
Just because now the blood cells are relaxed, and body says, yeah, I don't need to be so tight. Now I'm getting the oxygen. I mean, there's a response why the blood vessels are tighter and tighter, because they're looking for those nutrients. They're looking for that oxygen. And as soon as the delivery happens, the body realizes that, hey, now I'm getting it, let me just relax. And you'll feel that. Like if you come here and you start using this, use it for 5-10 times, see how you like it. And once you use it, we can do the, blood pressure, your own blood pressure before and after. And then you'll know yourself that it's working. Some people, eyes become red because the, blood circulation increases. So when they wake up out or get up out of here, all the sclera is all red. I mean, that's instant proof that it's opening up your blood vessels. And that's how I started noticing it before. The company also has another totally different line of products which are for animals. So they made a BEMER wearable jacket for the horses, and you can use them on your cats and the dogs and whatnot, right? And all these, Triple Crown winners, right? These nice horses, they have to be trained. So the trainers have figured it out that when they put this on the horse goes into the cart easily, and they can move the horse without any issues. And when they have to train the horse or the dog, they use this to help them feel a whole lot better. And they get trained easily. It's like giving a dog food because you want him to sit, and he'll sit, right? You're training. It's Pavlovian mentality. So that's what they feel with this, because animals are intrinsically in tune with vibrations of the planet, vibrations around them, and they know that this helps them a lot. So they bend over backwards when the trainer's coming and putting this on. They're like, all right, I'm going to be the nice guy, no more kicking and screaming. So that's what happens. And actually that device, it won the Red Dot Award for the best ingenious technology in Europe. So, I mean, they have tons and tons of awards for BEMER and that VMAT, I think they call it. What do they call it?
The vet. Yeah. It actually takes the horse in 5 minutes from a sympathetic state of fight and flight to a parasympathetic state. So when you see that horse, it's hilarious because he goes from, because they're like this, and he goes, the first thing you see is his eyes start blinking, he starts licking his lips, and then you'll see the head drops, and then you see that back leg go up within 5 minutes. Every daggone time.
Wow.
So it's, and people say, oh, wow, I wish they had those for people. Well, let me show you something. Because that horse doesn't know what he's supposed to be feeling. So, same thing with puppy dogs and kitty cats. They don't know that they're supposed to be able to go up those stairs again. Or the African violet, the little 80-some-year-old lady brought to me the other day and said, look, this has not bloomed forever. I set it next to my BEMER. It's energy.
Yeah, so it's pretty cool. I mean, so, this is NASA is doing a study on this kind of technology, how it can help people in space, because, in space there's no gravity, or where's the Vaso Motion coming from, right? It's only your heart. That's the only pump you have in space. So how can we have more blood flow in people who are sitting up in space? So they're doing the studies on them. They'll come out in 2020. That's the expected date of the release of the NASA. And actually, you can go on NASA's website. They have a actual letter. I downloaded that letter from their website of the collaboration, a full letter. So that was kind of cool. FDA has their own website. You can Google it. Hey, thank you very much.
Awesome.
So now we can see some things. All right, so let's see what we can come up with. So some of the stuff is going to be repetitive. I'm just going to zoom through most of the presentation because you guys have already heard it. But this will, there's a disclaimer about this product. It's FDA registered. You're not allowed to say that it works for migraine, even if it does. So, you know, we've all felt this kind of symptoms: restless, low energy, exhausted. And then most of these things, I mean, this is when you look at this picture, it's supposed to represent the crisis that we're in. We have so many things happening in the world, so many diseases. You know, the top 15 diseases that kill Americans are, almost all of them are 100% preventable and reversible. And, you know, when we have technologies that can help, then we can say, oh wow, there's a huge potential, because the risk of side effect is almost slim to none, other than detox. And detox is also good for our body. Right? We need to get rid of all those things that we're inhaling and ingesting. So, yeah, so I mean, we spend tons and tons of money on our healthcare. Trillions of dollars get spent, which is crazy. But you know, these surgeons, right? They should put people on this mat right after they. There should be a study like that.
There's a cardiologist, a chief cardiologist at Communist Heart Institute in LA. The protocol is BEMER before and after every heart surgery.
Wow, amazing. See, people are already doing those kind of things. It's just a matter of time when this happens. And about 2.5, 3 years ago, there were only 600 some machines. These were in the entire country. Now there are 40,000 plus, and they're flying, right? I mean, people are buying them, trying that out. It's whatnot. Ohio State, I just went to a conference over there in Columbus, and Ohio State they have for their team. OSU got them for their team.
But they don't advertise it.
No, they can't.
No. Because they don't want IU to know, right?
Yeah, they can't.
Or Notre Dame. Or
Michigan.
Or Michigan, yes, there we go. Don't tell Michigan.
So these are all the things that can help. You can name a symptom and answer will be yes, they will help. Right? The only contraindication as of now, I feel, and that's what they say as well, is people who have had organ transplant and are on immunosuppressant. Because this will increase your immunity. I mean, this will increase your immune cells. So the cells that are, all the white blood cells, 90% of them are called demarginated, meaning they're stuck on the walls of the blood vessels. When we have an infection, our white blood cell count goes up, because all these white blood cells, they start moving. So guess what? When you lay down on BEMER, your immunity goes up, because for that short amount of time, it's increasing and allowing those cells to move and find other infections and find things that haven't been healed yet. And that's what this is doing. It's going to places, it's finding, scavenging, and seeing, hey, I don't like this thing, let me get rid of it, right? Lyme disease, herpes zoster, varicella, all those. Like things that are hiding in the nerve roots or in the fascial layer, the infections that are dormant. Why are they dormant, right? I mean, that's the question I want to ask. Like, our bodies are so smart that we can pretty much get rid of anything, and now we can't find a varicella zoster virus in our nerve root?
I did that a lot.
Right, so that's a question I ask, and this is what it does. It increases delivery and finds. So they have 5 worldwide patents. You know, lots of people are using it. Lots of athletes, hospitals.
They use it on premature babies in Europe because it helps their bodies make nitric oxide.
So this is the end. This is the last page of the contract. That it's an open contract for NASA to do research on this BEMER. So BEMER started producing some products for NASA. That's all. That's what the contract is, so that the NASA can do their own research, that nobody else can produce it. So I talked about energy shift, right? This is the new science of energy. You know, I think we're in about a few years we're going to be past the conventional medicine world. The energy science is going to take over from that perspective. People are going to be more aware of their consciousness, their ability to produce energy. You know, and now, I mean, we have Carillion technology and all kind of things that can tell us our own energy. It can map out your own meridian channels and things like that. And the world is coming to a point where we're getting into a crisis, right? Whether it's water crisis, food crisis, you know, health crisis, and the shift is happening. Maybe it might happen sooner or later. And this is going to play, I feel it's going to play a huge role in helping patients heal faster. So, so Thomas Edison said, the doctor of the future will give no medicine and will interest his patients in care of the human frame, in diet, in the cause, and the prevention of disease. And that's what we all want, right? We don't want to end up with disease. We want to stay away from it.
How is this when you're taking supplements, herbs, good?
So all of these things have energy, right? Supplements have energies, herbs have energy. We have to match each person's energy with those energies of the plant, right? He's skinny, I may be average weight, somebody could have more. The body sizes, body constitution is different. And one is not better than the other, right? People have the same issues whether their body types are different or the same.
But if the nutrients are getting into where they need to go, it's going to make whatever you're using more effective. Okay, stronger. So you got to keep that in mind when you're thinking pharmaceutical, because sometimes you don't want that to be stronger.
Right. So when you use this, you want to make sure that you're talking to a healthcare provider as well, because you may be on some kind of cholesterol medicine, blood pressure medicine, or some supplements, and you don't want to have them work better, right? Sometimes you don't want things to work extra, right? If cholesterol medicine starts working extra, you might have a side effect. It might cause heart failure, dementia, or diabetes, right? I mean, there are tons of muscle aches, pains, myalgias, and every medicine has some kind of side effect. So you want to make sure that when you start using these kind of devices, and they're widely available in the market, and this can also it's also available in the market, you can purchase it, but you want to make sure that you are using it in the right fashion, with the right advice, and if you have other medicines, your doctor is able to take them off or knows how to wean you off of it, because otherwise you will have side effects. If you're taking blood pressure medicine, and after laying on here, your blood pressure drops 30 points, you don't want that medicine to work at that point, because you're going to drop another 30 points. And, so this happens every day in my office, right? So I see it every day when patients come in with all kind of things, and I'm just weaning things off. And this is an additional tool that helps, right? And we try to match the energies of the plants and supplements to ourselves. So electroceutical. This is a new field. I mentioned that earlier. GSK. It's registered, patents used by a lot of universities. We talked about PubMed. So the Iceberg Principle, we all know a lot of things about this principle, right? When you only see a little bit, there's usually a whole lot more. And all of us are like that. When you see a little bit, there's probably a whole lot more behind that curtain, right? Everything is like that. So our bodies are like that. When there's one symptom, that's because of some other things that have had a domino effect, for which now that it's leading to a symptom. That leads us to low energy, and this helps increase the delivery of nutrients, so it helps heal. So we talked about this, right? 74% of our bodies are microvessels. Come on. There you go. Oops. So this is Dr. Rainer Klopp. He's the guy who did the initial studies on BEMER, and he had a live electron microscope, and he looked at the body what happens when you give the BEMER frequencies. And that's how we figured out that before BEMER, red blood cells were all clumped together. After BEMER, red blood cells are all open. And during BEMER, they're opening as we speak. The blood vessels are just opening right up. And those videos are available on YouTube. You can look at my website as well. They're on there. And, you know, do your research. There are tons and tons of doctors. Like, there are very famous doctors who are also using this machine around the country and in the world. So I had mentioned 10 and 32, but it's 10 and 30. And then every frequency goes up from 3.5 to 35 microtesla. So it helps with all of these things. So these are all the different other machines, right? There's IMRS, and there are other machines that are out there. I don't want to name them. But they use this kind of technology. They're the wave pattern at which we send signals. Like this computer has them, this has them, this has them. Everything has these different frequencies. And this is what BEMER does. They're delivering a type of frequency that starts out slow and amplitude goes up, and then it comes down, gives you rest, and goes up. So when you look at that, you can actually see that right here. So this bar represents this frequency. Oops. All right.
Oh,
That's
sorry.
okay. Sorry.
We'll fix you right back up, don't you worry.
And then in that in between the bars, there's space, and that space is this resting phase. You can't allow the body to have continuous wave of energy, right? These other machines have somewhat of the same different way of doing it. And then this is in a slow progression, and then it comes down. So, which is kind of cool. And they're in their own class. I guess they named them, all the other machines that are out there. So that's... There's IMRS, there's SensiPlus. They're all good machines. I mean, it's not bad. But this is what's happening, right? When somebody uses BEMER day 1, day 2, day 3, the effective percent change in the blood flow, let's say it goes up to 30%, and then as you stop doing BEMER, on day 4, you're still above 10, while the maximum effective change in the blood flow is maximum 10 for all these other guys. So this is an accumulated effect, right? The cumulative effect. As you use it more, the longer the effect will last, which is kind of cool. And it's an experience, right? Once you use it, then you can tell yourself, oh yeah, I had it here, and now it's here. So yeah, it's pretty easy, touchscreen. It's pretty simple to use. It's nothing. It's easier than our phone.
Better signal too.
There we go. They're just showing you pictures of this entire device, the BMAT, the machine. You can wear it on your arms as well. There is a padding, so that little thing, the round B spot, you can use it in your arm, on your body. This is light therapy. Oh yeah, this is really cool, right? If you want to get rid of wrinkles, most non-invasive way of getting rid of. So I don't know, right? I cannot say that. But I will do those experiments with patients, in which we're doing, and we'll find out. I mean, the testimonials will speak for themselves, the before and after pictures and things. But officially, I cannot say that. But it helps. It absolutely helps. We talked about the sleep program, and that's what all the attachments and bells and whistles in this. Yeah, so that's pretty much it in this whole presentation. If you guys have any questions.